today's video is going to be about skin to skin. Whether you are someone that just had a baby, you know someone that just had a baby, or you're just interested in breastfeeding education, this is the video for you. I am your certified lactation counselor officially, okay, because I got my results back and I am board certified. Never been happier. But let's get into the video. Okay, so skin to skin, a lot of people know about this, but a lot of people don't know exactly what that means. You need the baby to be delivered, obviously, right? So skin to skin is for everyone. It's for mom, it's for dad, it can be for grandma, depending on how comfortable you are. So say you go into the hospital, right? And I'm a former labor and delivery nurse. You go into the hospital, you have your baby, cool. Everyone's so excited. Oh my God, the baby, the baby, the baby, right? Everyone wants to know the weight, the limbs, the, you know, the height, all those things, which is cool. But here's the thing. Skin to skin. So we call it the golden hour. The golden hour consists of an hour of skin to skin post delivery, and this can be done in the OR. It gets a little tricky in the OR depending on your providers and things like that. I personally haven't had that experience because in the hospital setting, OR, like C-section deliveries are considered emergency or at least critical, you know, for newborn, and so a lot of times they take the baby to the warmer. Anyway, long story short, we're going to just talk about a vaginal delivery, so, and postpartum. So during a vaginal delivery, the baby comes out. The baby's oftentimes, we ask the mom, is it okay if we place the baby on your chest? At that time, we go ahead and undo her gown, the little snaps on the side, and we place baby right in the middle of her chest. Multiple reasons why we do this. We do this because mom is going to regulate baby's temperature. So her temperature is going to either increase or decrease in order to maintain or stabilize baby's temperature. Another thing, we want smells to be, you know, related. So a baby, although they just entered the world, knows their mother's smell. I don't know how. Okay, I probably could do some research, but I am not a researcher. I'm just a nurse. I just know the information and I relay the information. I can try to find out some, but a baby knows their mother's smell. And so this initial contact with mom is kind of letting them know, hey, you're safe. It's okay. It's cool. Calm down. Chill out. We are all good here. Your mama's here. And for mom, this is also a good and safe space because her baby's here visually. She can see that everything is okay. We tend to do everything on the chest. So we try not to interrupt skin to skin or during that first hour period. As a nurse, I do my best to wait until a full hour. So we're cleaning the baby on the chest. We're getting vitals on the chest. We're doing everything. Literally everything. The only time we try to take the baby off the chest is when there's a medical emergency. If there's not, keep the baby skin to skin, okay? Right after delivery, the golden hour, baby goes skin to skin. Another time that baby goes skin to skin is during breastfeedings. Another reason that I mentioned before, because of sense, because of vital stabilization, so heart rate, temperature, even the blood glucose can be stabilized through skin to skin. It's a physiological process, like I said, that I am not getting into because I am not your physiologist. I am your registered nurse and LC, lactation counselor. Ooh. So when you're breastfeeding, it helps maintain the latch. I love a little kangaroo pouch. Put that baby right on up in there, you know, that way it's easier to hold. Baby is easier to hold, and then mom, you know, and baby can also bond that way. It calms babies down, okay? A lot of babies are not aware of what is going on. They're like, it's cold out here. I've been swimming in water for all my life. It was warm. It felt like a jacuzzi. I was comfortable there, and now I'm disrupted into this cold air. Nothing soft. We put babies in hard clothes. Even though cotton feels soft, it's hard. The baby's skin is so sensitive, and then we put the baby in a bassinet that's still and just sitting there, and the baby's like, but I've been, you know, rocked around all my life. Why all of a sudden am I sitting still? So skin to skin can ease a baby's mind. So during breastfeeding, after breastfeeding, having the baby upright, burping the baby, skin to skin, helping that gas come up, helping baby fall to sleep and maintain a deep sleep before putting the baby down. Okay, sometimes we rush it too much. We're like, oh, put that baby down, put that baby down. Hold on to the baby just for a little bit. Let the food digest or milk digest, and then place the baby into the bassinet. All right. And I'm kind of reiterating a lot of things. So postpartum period, a lot of times we want, if the baby can be placed skin to skin during a hearing screening. Okay, this is a not so fun process for the baby. You know, you hear like frequencies, and so the baby's neurological response will let them know, a tech or the hearing screen specialist, let them know that the baby is able to hear. But if the baby is crying, the test is like void. So having the baby skin to skin during that test, we do billies, so bilirubin checks, it's their heel pricks, also glucose checks, their heel pricks. So we take a little small needle. I know parents don't like this, but we take a small needle, we prick the baby's heel to get blood in order to do the test that we're looking for at that time. Babies don't like it, understandably. Adults don't like being pricked either. So having the baby skin to skin really helps at that time to maintain the baby's level of calm, chill, okay, zen vibes. I will say a lot of times when I am doing my baby's vitals and you unwrap a baby, they're startled, they have a startle response, so their respirations usually increase, their heart rates usually increase, and having them skin to skin. As a nurse, this is the benefit for me. It helps normalize those vitals, because I don't want to take the baby and then like now we have to go to the warmer in the nursery and then mom and baby are separated. Those are, no one wants that. Okay, the nurse doesn't want it, the mom doesn't want it, the baby doesn't want it. No one wants it. And that goes for temperature stability. So sometimes babies can get cold because they don't have great temperature regulations. Having the baby skin to skin is important. Dads can do skin to skin. Before we go way too deep, dads can do skin to skin. That is okay. It's normal. It's healthy. Let the baby smell you too. That is a bonding process between dad and baby. Take your shirt off. Dads, we don't care what you look like as a healthcare provider. I'm not interested, you know, never was. I'm not going to be, but it is for the sake of your baby. So you can also do kangaroo care. You can take your shirt off, lay with the baby on with a blanket over top covering. It can be great when mom is sleeping and the baby just wants some kind of like tender loving care, a little personal touch. Let mom sleep, put the baby to the chest. That will keep the baby quiet, calm, and satiated longer. Now, here's the thing I will tell you. The only time I do not want to see skin to skin is when you're falling asleep, okay? I do not like, especially if I'm in the hospital and there's a lot of liability there. I tell my patients all the time, you know, as a safety precaution, if you're tired or you know you are drifting off to sleep, go ahead and put the baby down. I have seen babies fall before, okay, and it's a big workup. Luckily, everything was fine, but it is not fun to wonder if a baby will fall, a baby has fallen. It just, and every like neurological responses, you want to make sure those things are intact, but it can be stressful to do those tests, one, and then to get the results of those tests, and you don't want to find out the baby has a hemorrhage, you know, like a subdural bleed or something like that. Like, this is the new baby. Just don't sleep with the baby on your chest. Please, please, please. Babies roll over and fall, or sometimes what I notice is that you're holding the baby like this and then you relax so much that your hands go down. Or if I'm the nurse, I'm knocking the door, you know, hi, it's Jasmine, I'm your nurse for tonight, and I startle you. Now you have a response, and then that can cause baby to also fall. So no sleeping with baby, please and thank you. It would be greatly appreciated for your sake, our sake, and baby's sake. It is super comfortable to have your baby skin to skin. Also, physiologically, it is helpful to normalize vitals and blood glucose. If you're interested in some more helpful tips how to do skin to skin, please leave some comments below. Let me know what you like and other topics that you would be interested in hearing about. Thank you. You guys have a great day. I'm gonna talk to y'all later. Okay.